The Midday Show, live on QBS.
We're touching on a topic that is pretty important, and it involves children, specifically those born during the pandemic, also known as COVID babies. Now, today, this is a topic, I have to add that this is a topic that is quietly but powerfully affecting an entire generation. And these children entered the world during a time of isolation, masks, disrupted routines, and now as they grow into toddlers and preschoolers, researchers are beginning to uncover the developmental impacts of that unique start. And one area that is drawing increasing concern is speech and language development. Now, according to research, pandemic babies are experiencing notable delays in speech and language, and these delays are attributed to factors such as reduced social interactions, limited exposure to language-rich environments, and disruptions in early developmental milestones. Now, the pandemic restrictions led to smaller social circles for infants, reducing their exposure to diverse linguistic inputs. And many babies had minimal interactions with peers and were primarily exposed to adult conversations, often through masks, which may hinder language acquisition. Now, in addition to that, there is an increased parental stress and changes in caregiving routines during the pandemic that may have affected the quality of interactions between parents and infants, which also potentially impacted their language development. Now, it's a massive topic, and it's not just the infants and the babies that were affected. We see it in preschoolers and those in elementary school. It's a massive topic to uncover, basically. Did you know reduced vocalization and conversational interactions? And this is a study done by the Lena research that found COVID-era infants produced significantly fewer vocalizations and experienced fewer back-and-forth conversations with adults compared to pre-pandemic peers. This reduction in early communication is linked to potential language delays. In addition to that, longitudinal research following infants from 7 to 30 months revealed that pandemic-born babies exhibited lower word segmentation abilities at 12 months and delayed word learning at 20 months. Their lexical development between 12 and 24 months was also slower than that of pre-pandemic infants. On top of that, there is data from the Coral study in Ireland, which indicated that by age 2, a higher percentage of pandemic-born infants scored below standard developmental thresholds in communication skills compared to their pre-pandemic counterparts. And this suggests a mild but measurable communication delay. It's a massive topic to uncover. We're talking about children and, their speech delays or speech issues, specifically children born during the COVID-19 pandemic, also known as pandemic babies. But we don't just see it in pandemic babies. We see it in also, elementary school children who had just started school and then had to take a pause on that due to the pandemic. It affects a whole scale of children, a whole entire generation, right? I think they're called Gen Alpha. So all of Gen Alpha is impacted by the pandemic, and it shows in their ability or lack thereof to read and to communicate. And these are the most important years of their lives to do those things. We've got a special guest here in the studio to discuss the topic of speech delays in children, specifically those born in or during the pandemic that was COVID-19. So one of the most incredible things is to witness, a child finding their voice and learning to communicate with the world around them. But the journey of speech and language development isn't always smooth, and sometimes children face unique challenges. And today we're discussing these vital early communication skills and exploring some of the factors that can influence them. And in recent times, a global event has added another layer to the conversation, the COVID-19 pandemic. We're fortunate to have with us Dr. Olfa Fellah, a dedicated speech pathologist for more more than 16 years to shed light on children's speech development, especially the specific ways that the pandemic has shaped their communication journey. Welcome to the show, Dr. Olfa. It's great to have you here.
Thank you for having me on the show. Thank you. Hi.
This isn't your first time here in QBS. You've been with us quite a few times. We love having you here.
Yeah,
so it's great to have you back, I should say.
Thank you so much. I'm really happy to be here today.
We're honored to have you. So let's get straight into it. What are some of the key milestones in early speech and language development that parents and caregivers should be aware of in young children?
Okay, so children typically follow a predictable path in speech and language development. For example, by 4-6 months, babbling begins, like baba, dada, and babies respond to sounds. It means like combining sounds together, consonant and vowels, baba, playing with their vocal cords. So by 12 months, they might say 1 or 2 words like mama, dada, understand simple instructions, responding to their names. Also, it's very important to use one word, even it's not understandable, but in the right way and in the right context. For example, if a child he asks for water and say wawa. It's better to say wawa better than saying anything else, none really fit well in the context. So by 18 months, the vocabulary expands to about between 10 to 20 words. They can name familiar people like auntie, sisters, brothers, or any other objects. Also, in this context, I always advise the parents to use the naming things instead of saying, give me that, give me this, give me that, you see? So it's better to name things. Give me water, give me spoon, to enrich the vocabulary for the kid.
And this is by 18 months?
Yes, by 18 months. And this stage also, gesture became an important form of communication, like pointing, like shaking head to say no, waving for bye-bye. And it's very important also, like using a simple understanding and using some words and combining together orange juice, I want drink water, drink water, combining 2 words together. By 2 years, using also here the vocabulary grows rapidly, and the kids they have to talk more fluently, asking using 2 words and 3 words together. There's the sounds, the intonation. In 2 years, you have to check if your kid is using the intonation. Mama, let's go. Is it good? Is it not? Like that. This is the intonation of the sound. And at 2 years also, the kids might play a lot, asking a question, observing the commands, following instructions very well. By 3 years, here the explosion of vocabulary. Here, jumping, using 200 until 1,000 and more words.
Really? By 3?
Yes, by 3. And don't forget that by 2 years, they use jargon. The jargon speech, it's not something we cannot understand, but at this age, by 3 years old, the child will stop talking with the jargon. We will have a clear speech, okay? And he can tell a story, what happened at school, what happened in nursery, take turn in conversation, playing interaction, using plural also, cat, cats, dogs. At this age also, these kids can ask a lot of questions, like using also pronoun, following more instructions, more commands, understanding, responding to names. Of course, responding to his name from 12 months, starting from that age. Responding to name and returning face and asking, observing a lot. It's language is receptive and expressive.
Yeah.
So expressive language by this stage, and receptive language starting even from his from being in the
womb.
Yes, exactly. By listening the heart beating of his mother, if she was angry, if she is happy. So many things, many skills the kid may develop, and through these stage of life, through these years.
That's why they say it's important to speak to the fetus in the womb.
Exactly. Speak to them, listening to music, be kind to him. It's very important. And as I always say, that in every word a child speaks, there is a love. It means that the love in the way they call out mama for comfort, love in the way they try again and again to be understood. That their voice is a reflection of the word we've built for them. We've built for them for what? Full of warmth, full of patience and presence. So we have to hold the space for their silence and celebrate each sound. Because how we celebrate, make a birthday, when the first sound coming like ba, ma, we celebrate that. And because every little word is a miracle, and every conversation with a child is a chance to say, I am here with you, I'm here to hear you, to believe in you, and to believe in your skills. I see you. The presence of the parents, why the development of the language, it's very important. Really, the presence of the mother, the father, the family, it's very important for the development of the language, because language, as I say, it's not only speaking and talking, no. So this is the beauty of language, it's the magic of growing up together. Yeah.
Moving on to the context of the post-COVID era, what specific shifts or delays have you observed in these milestones, and how has the limited naturalistic language exposure during the pandemic, with, of course, the increased reliance on screens like iPads, potentially affected the development of these crucial language skills?
Yes, exactly. During the pandemic, many kids stayed at home, because schools and daycare were closed, so they were not able to interact face to face with peers. They missed out on learning important social behavior, like turns in conversation, understanding emotion through the body language. To understand how you are angry, he needs to see that. How he's happy, how is he's thinking. So all the body, they missed out all of these skills, because these are all vital skills that children usually develop through what? Through play and real life interaction. And as a speech pathologist, and many other my friends also, I have a lot of speech pathologists, we observed delays in expressive language, using some words, not a huge number of words. The
vocabulary is smaller.
Exactly, reduced vocabulary, social communication also skills, shorter attention, especially visual and hearing attention. There is some difficulty in turn talking, like I say, limited interaction, along with increased screen time, the social isolation and heavy screen reliance, and led to fewer opportunities for children to practice and hear natural language. By the way, watching TV, there is a lot of studies shown that it's dangerous for the development and social and emotional communication skills. So it's like you say, it's a massive. It's really a problem. Watching TV for a prolonged period changes the anatomical structure of a child's brain.
I see.
And lower verbal abilities. So it's very dangerous. At that time, many kids were touched a lot to screens.
Yeah, their iPads, their mom's phones.
Yes.
I know, my best friend has a niece and a nephew. And when I was first introduced to them, it was around 2021. You know, I would just be sitting there, and her nephew, mashallah, he does love me so much. He always comes to me. But the first thing he tries to grab is my phone.
Sure.
Right?
Yes.
And his mom is like, no, don't give it to him. And I'm like, your mom says no, right?
Yes, exactly. Me too, when I go everywhere.
Right.
Trust me, everywhere. I find some kids, even now, because they get used it. So I advise the mother, even I don't know her. I advise, please don't give him the phone, please. It's not really. And some others, they say and reply, oh, no, it's very beneficial. You know, he learned a lot from the phone. He gets some new words. He knows the colors. He knows the numbers. But this is not a communication. Knowing numbers and colors, and it's not really a communication. And shapes, triangle, square. This is not a communication. Your kid, he's not expressing himself.
Right.
He's not expressing what happened, telling a story, what happened to him.
Right.
So this is the problem for watching TV a lot.
Yeah, we see it a lot, and then some kids tend to throw tantrums when you try to pull them off the screens.
Yes,
so
exactly.
That's the only way they know how to express themselves now.
Because you know why? Because many other research showed that watching TV can trigger the release of endorphins, dopamine, and serotonin, which make the body feel good while watching TV. In addition of this, the brain showed thickening in a frontal lobe region. So the changes in the brain tissue occurs regardless, of course, the child sex, etc. But other studies, which is very important to know, have shown, that for each additional hour of television watched in childhood, the odds of developing symptom of depression increase by 8%.
That's a lot.
Yeah, that's a lot. Of course, so it's watching TV for long hours. It can develop for after many years after the depression, not only for kids, for adults.
Yeah.
Yes.
I was about to say, my generation, Gen Z.
Yes.
Already, we show a lot of signs of neurodivergence,
exactly,
mental health, like lower mental health stability, things like this. I myself have a lot of those things.
May God protect you, but it's very normal.
Yeah,
life is up and down, so it happens.
Of
yeah,
course.
It happened.
But my generation is like the start of it, so I can only imagine how much worse it has gotten for the younger generations that live on the screens. They literally live. On the screen, constantly to their face.
Yes, even when you go out for a drink or to a restaurant, you can find two friends together. They're only watching TV, not talking.
Right.
She's watching her phone, and the other one, she's watching also her phone. So less of communication and less of also, there is an intelligence, social intelligence that we have to build by interacting.
Right.
So we interact to each other to know how to deal with any other situation. So by what? By talking, by giving back information, engaging. Exactly. The social intelligence will be lower if you are not talking and contacting with other people. If you stay only on phone, it's really dangerous.
What are some of the early warning signs or red flags that parents and caregivers should watch for that might indicate a child is experiencing difficulties with their speech development?
Okay, let's say the red flags. Okay, for example, no babbling at 9 months, 4 to 9 months, no babbling, no playing with vocal cords. Let's check the hearing, if he has some problem in hearing or not. And if there is no first word by 15 months, let's wait to 15 months, it's okay, and see if there is some words or not. If he's not combining two words together by 24 months, and if he has a poor eye contact or little interest in communication, he's not smiling, he's not interacting, he's just turning, if there is some flapping hands, some behavior issues, some behavior problems like flapping hands, poor eye contact,
if he's
walking
like fidgeting,
yes,
things like
walking
this.
on tight toe like that. So It's also important to observe the kids during that period. Difficulty following simple instructions. If you ask him to bring the ball, he's just looking at you without doing anything.
Like a cat.
Yeah, exactly.
When you tell your cat, come here, and your cat's just looking at you.
Yes. So, and clear speech beyond 3, the age of 3. He's still talking with a jargon. After 3 years, this is also a red flag and early warning sign of speech difficulty.
I see. Now, what can should a parent take them to a speech pathologist like yourself immediately? Yes.
It's very important to go and diagnose in early age.
Okay.
Because the early age you diagnose the kid, the results will be perfect and in a shorter time. Okay. Not like
because they're still like a sponge.
Yes, exactly. And putting in a nursery, take them in a nursery. It's very important. Between 12 to 18 months, I encourage the parents, especially to get contact with other kids and talk and learn a lot of things in a nursery. I advise also parents to read books for their kids, to stay with them more time, and to play, like playing a story. Today we will play me a mother and you a kid, so changing roles. It's very also it's benefit this one, this game, going out together to a supermarket and let's shop some vegetable like potatoes, like, give me that one, and you can also use the colors. Let's take some tomatoes, a red color, oh nice, and let's put it inside. 1, 2, 3. This is counting, you see, so many skills in one, going out in one,
right?
Yeah, so talking about and naming things. Also, it's very important. Observing and take the kids, checking his hearing, checking his mouth. Maybe he has tight tongue. Sometimes he has some speech disorder like sounds articulation disorder. We need to check with the ENT doctor, with a speech pathologist. And if I observe some behavior issues, straight I go to a psychiatric or psychologist and check if he has some mental impairment, like that.
Right. I want to know, beyond just the words themselves, social communication, we know, is vital.
Yes.
So what are some of the typical social communication skills children develop through interactions with others?
The social communication skills include joint attention, like sharing, focus on object and activities, turn talking during conversation or play, using also gesture and facial expressions, eye contact, it's very important, understanding and using non-verbal cues, like looking at you and understanding what you want to say, responding appropriately to other emotions, like that. It's this is the
like when they're sad or angry, instead of just screaming or throwing a tantrum.
Exactly.
Being able to actually express that.
Absolutely.
Okay.
Yeah.
I see.
Yeah, I have one of example. She was born in 2021, 2022, like in pandemic period. The kid unfortunately came to our clinic after 2 years with a speech delay.
Yeah.
And speech and behavior concerns, but he was not autist. It's diagnosed by being a TV child.
Oh, a TV child.
Yes, because a TV child is different from being autistic kid. TV child, it can be. He has some verbal language. He can talk. He can use some words. Okay, but he's a TV child addicted to a screen, addicted to TV. He can flap hands. He can use some behavior. He has some behavior issues, but he's not really autist. because of watching a lot of TV and being in isolation for a long time.
He was displaying signs of autism, but he wasn't autistic.
Yeah, no. It was just TV child.
I see. That's how badly it can affect children.
Yes. That's why, because we were talking about social communication skills.
Right.
Yeah, I just remember that kid. And
well, hopefully they're doing much better today.
Yes, of course. We were playing. We were doing some exercises. We put some goals for him, short goals and the long-term goals. And now he's fine. Alhamdulillah. He's very fine.
That's good to hear. That's great to hear.
Alhamdulillah. Now there is a lot of success story. Alhamdulillah. And now they are fine. Even for language delay, the parents should not be really afraid, because he can be okay and final. He can be
right. This is not something that has to stick forever.
No, definitely not.
Well, that's good to hear.
Yeah.
That's important to know, I feel. I want to ask you, what are some key strategies parents and caregivers can use to support their child's healthy language development and promote good oral and motor skills for clear speech from a very young age?
Talk a lot with your child, even during simple things like cooking, cleaning, baking cake, and give them more instructions. Give me eggs, give me name things, okay? Read the stories together every day. It's very important. And it's better to be a book like with pictures, a story with pictures, and play pretend games that I talked about it. That it helps a lot of children to use new words. Keep a daily routine. It helps them to feel safe. Limit screen time. And encourage real conversation, talking about the stories, something happened before, be patient and listen, give them more time, because every child is different and has different needs.
Right.
So it's very important also to make like a massage oral here in his mouth.
Around the mouth and the cheek area.
Exactly, there. And talking a lot. It's very important to be present with our child, reading, as I say, story, I think, and play. It's very important to play, throwing the ball, kick the ball back, etc. That is it.
Okay. If you have any input or experience on a child growing up with pets in the house versus one that has no pets in the family, and does having pets around children while growing up affect the child's brain development and interactions with others? If so, how?
It's perfect. I like having pets, and I advise to have a pet at home, and especially dogs. It's friendly, playing, interacting. It helps also the child to play, to communicate, and to interact with this dog or cat or rabbit or something. Pet at home, it's very important for the development of the language, like taking care of someone else at home, giving them milk, washing, taking care after this pet. It's very important for their social skills, language skills. It's very important to have a pet, at home, I advise.
What if the kids are refusing to speak, and how do you handle that?
Okay, by the age of 2 years. So if your 2 years old is not speaking yet, it's understandable to be concerned. Okay, but by the age of 2, because by the age of 2 he has to use 50 words.
Right.
But we can understand that it can be classified as a late talker. Right. So he has to see if he doesn't have a tight tongue or something else, checking with his hearing, checking with a speech pathologist, and he needs to see a speech pathologist to diagnose and start the speech therapy sessions.
Right.
Because it's a little bit late.
It's so challenging for moms and even dads to be present because work is demanding and everything is so expensive. So is there a way that you would advise parents to make or spend more time with their children?
Yeah, exactly. Simply talking with your child about anything. It can stimulate language growth. Describe what you are doing. Describe what you are looking. Name object around the house. Sing songs together. For example, choose which song the kid likes, and sing it with him. Just sit and read a book. It's not about perfection. It's about presence. Okay, I know in today's busy world, it's easy to get caught up in routines, work and screens, but sitting aside, even for 15 or 30 minutes of undivided attention each day can make really a big difference. Child sense when you are truly present, and that safe, loving connection builds the foundation they need to learn, speak, and grow. So it means that your time is the most important and meaningful investment you can make in your child's future. Even in 10-15 minutes. During 10-15 minutes, just reading a book or talking about which is around yourself, around your house, the object, reading story, talking a lot. Give them each day 10-15 minutes of a full presence, a full attention, not talking and looking to the phone like that, you see? So yeah, it's very important, your presence. Even I know it's difficult nowadays. I know we are the same. Before being a speech pathologist, I'm a mom. So
Right.
it's the same. But we need to give them, even before sleeping, take 10-15 minutes and talk about your day, how it's going on with your kids, how you deal with that problem, if there's anything, do you need something else? Not only providing, we are working, to provide food, to provide whatever the kid needs, but we have to provide time, we have to provide our emotional skills, we have to provide our love, because that's what he needs.
Right. So I know a child that's about 6 or 7 years old. Unfortunately, they weren't able to be enrolled in school or nursery or anything at a young age. So now they're around 6 or 7 years old with speech delays. They were just enrolled in school, but still the speech delay is still present. So how can we as the community for this child help him develop his speech better?
At 6 and 7 years old, nothing is too late. So we have to, as I said, talking too much, be present with your child, doing some exercises, conversation turn and talking a lot, having speech therapy sessions, behavioral therapy sessions, because it's a little bit late at 7 year old. It's a little bit late. So at 7 years, he needs to talk and to say stories, the long stories, using many words, using many sentences. So nothing too late, I say. So just to talk, and he needs some help from the family, from the friends, etc.
Yeah. Okay. As long as I know it's not too late.
No, it's not too late.
Because his speech is becoming more clearer day by day.
Very nice.
But
so he's progressing.
Yeah, he is progressing.
Yeah, better than being in the same place or regressing.
Yeah.
Once the child is progressing, that means we are in the right way. It's okay. But if he's regressing, la samahallah, or he's delayed and stay in the same place, that's really...
that's where the issue comes in.
Yeah, exactly.
Okay. If a child is showcasing speech delays and they were also diagnosed with a neurodivergent condition, let's say something like ADHD that already affects their attention span.
Exactly.
How would you go about helping that child?
Yeah, for attention, visual attention and hearing attention deficit, we help them during the speech therapy session by matching pictures. It helps the kid look into the picture and match it to the right place and put it. So this kind of exercise, it's very important to play with the kid by matching each one, hearing, listen to you, follow your instruction, following you are asking him, now look where is the right place of this picture, you will put it. So this attention, visual attention and hearing attention exercise by playing games, it's very important to help the ADHD kid to progress and to be more attentive, to be more talkative, and that is it, and be better than before with this kind of exercise.
How can I understand what my child is trying to say?
By which way? With gesture, with like bubbling, jargon. So if the mother cannot really understand her child, even by jargon or so it's really difficult. She has to take him to a speech therapist and assess the child. So to understand, most of the time the child can use a gesture, for example, or some sounds, or crying if he likes, for example, something and he didn't fight. She has to understand by her mother way.
Selective silence in kids, what causes it and how can it be cured?
Yeah, selective silence, it can be cured, by the speech pathologist, but assessed by a psychologist.
Right.
Yeah, it has it's important to go to psychiatric or a psychologist and then come to a speech pathologist and take your speech therapy sessions. Then everything will be okay. It's not really big deal.
How to test for ADHD?
With the psychiatric, with the psychologist. Yeah, they have their assessment and that's their job.
I see. Now, lastly, I want to ask if you have any advice or a final message for parents of children born during the pandemic or post-pandemic. Any advice or final message you'd like to give to them?
Okay. More strategies or only advice? More strategies. We promote emotional expression, like encouraging children to express their emotions in a healthy way. Provide like a routine to feel safe, like having set times for meals, homework and playtime. Helps create a sense of stability. Teaching children basic relaxation techniques like deep breathing or simple mindfulness exercise. It can help them also manage stress and anxiety. If possible, let's start with a small social gatherings and play dates with trusted friends, of course, or once a family. It helps a lot. The children ease back into social interactions without feeling overwhelmed. Spending time outside, whether it's going for walks, playing in park, also being patient. It's very important for the parents to remember that the children may not immediately go back to the same behaviors before the pandemic. So they have to take time and wait for them. I know it's very hard, but it's okay. They will come back. But also I want to send a warm thank you to every parent, teacher and caregiver listening. The pandemic may have created distance, but it's also reminded us how important love, connection and communication truly are. Our children need us now more than ever, because to listen to them, to speak with them, and to believe in their ability to heal and grow. With kindness, patience, and hope, we can help them find their voices again and again. That is my word for all the parents and the caregivers.
I love that. That's very beautiful.
Me too, yeah.
That's very, very beautiful.